Hi, everyone. I'm Dr. Matthew Harinstein. I'm the Senior Vice President at UPMC International, Chief Operating Officer and Associate Chief Medical Officer, and really a privilege to present on this topic. We've had a great conference and now want to talk about the past, present, and future, and UPMC's perspective on the new normal for virtual care, as we've certainly seen a change over the last year and a half. So just to remind everybody about UPMC's international presence, we really believe that everyone should have access to the best possible care without having to leave their country or region. And so really with that in mind, virtual health and telemedicine can play a really important role in trying to deliver care globally. So just as you might recall and have heard today, we have operations in Ireland with 3 different hospitals, including our recent acquisition of Odd Even Hospital, 2 radiotherapy centers, multiple sites in Italy, as well as our planned hospitals in China and our work in Kazakhstan. So when you think about the past and the history of virtual health and telemedicine, the WHO defines telemedicine as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interests of advancing the health of individuals and their communities. So when you synthesize this down, there's 4 elements that are associated with virtual health or telemedicine. First, its purpose is to provide clinical support. 2 is it is intended to overcome geographical barriers, connecting users who are not in the same physical location. And it involves the use of various types of information and communication technologies, and its goal is to improve health outcomes. So as we look to the present and the future, really implementing new technologies, working with our colleagues to deliver care globally is really at the core of what UPMC and UPMC International plan to do. When we also think about the history, telemedicine, even prior to COVID has been oftentimes, curbside consults, second medical opinions, really just thinking about image transmission, whether it's, simply an X-ray or, full-fledged radiology, and even maybe telephone visits going back years ago, as we've now moved it more into the video visits. As we've seen, we've had more of the video visits that have come on over the years, and I think really people have become very much accustomed to using this technology now during the era of COVID-19. We also think about remote monitoring of different conditions such as congestive heart failure, and also the store and forward concept related to image transmission, telepathology, and so forth. When we think about video visits, we really transition from these telephone visits to 2-way video communication, and we use this in many ways now. We started using this more so for anywhere care, what we call anywhere care visits, where patients could call in sort of in an urgent care type of situation. If they had an issue, they could call in through an app and talk to a physician or provider and get immediate care. But now when COVID-19 occurred, we really had to pivot very quickly and transition to a situation where we tried to keep all of our patients safe and at home. And so we really transitioned to, in many ways, 100% telemedicine visits at times during 2020. And as regulations are relaxed, there are new opportunities for telemedicine visits, thinking about, how do we continue to use telemedicine? How do we continue this virtual health? Patients want to come back, they want to be seen. And for patients we haven't seen in a year and a half or 2 years, this is a great opportunity for us to see them in person. But we certainly recognize that there is a great opportunity for us to continue to use telemedicine and make it a part of our regular routine of care. And some of those opportunities might be for things like preoperative visits, care in nursing homes, quick follow-up visits like blood pressure checks, or trying to monitor for physical exam changes, like for swelling of the legs if you're monitoring for heart failure, and so forth. So as I mentioned, this has really been a key component of our care in the present time. And this is an app that we use at UPMC called Anywhere Care. It really provides convenient, high quality care to patients where they can go on through an app and interact with a provider. A diagnosis and treatment plan can be made, and actually orders and medications can be can be provided right from that visit. And so patients, just from the comfort of their own home, can actually get full care. And if they obviously need to be seen, that can be arranged as well. But this is a great opportunity for the present and, again, expansion into the future. When we think about our experience through international UPMC, again, many organizations focus on bringing their patients to the United States, whereas at UPMC, we're really focused, again, on bringing the care to the patients and where they're located. And so we've had telemedicine collaborations globally for many years, and looking at even care that's been provided through our Children's Hospital of Pittsburgh. We've had care provided to Central America, South America, and then into Italy, all from a central location. So this really demonstrating how we can impact ICU care, critical care, and other services over time. One such example is our transplant hospital in Palermo, Italy, Upmec, and looking at our Teleicu implementation. This is something that we've been going on for many years. The components of this system is we have video conference equipment allowing remote physicians to discuss cases, perform rounds with the on-site clinicians, and view the patient. So all the way from Pittsburgh to Palermo, Italy, we've had the opportunity to provide high-level ICU care and collaborate with the physicians there on these very, very complex patients, which has been extraordinarily valuable and is really a model for us in the future as we expand into other regions, and particularly into China, to be able to provide care even from now Palermo to China or from Pittsburgh to China. Great opportunities to expand our care model. These IT systems are able to share vital signs, radiology images, current and past therapies, and physician documentation. Another opportunity is in remote monitoring, as we mentioned. Remote monitoring is really the concept of monitoring physiologic data. So things like vital signs, blood glucose for patients with diabetes mellitus, physical exam findings, and symptoms. This can really be helpful in reducing unnecessary visits and hospitalizations, providing patients with a pulse oximeter to check their pulse oxygen saturation, to check their heart rate if they have arrhythmias, to check their weight, and to monitor for changes in fluid overload. Common conditions that we utilize for remote monitoring would be congestive heart failure, hypertension, diabetes mellitus, COPD, even for patients with dementia that we can monitor falls or for changes in their condition. And then, of course, more recently is COVID-19. This has been a key component in trying to make sure that we can monitor patients when they're either not admitted to the hospital or when they've been going home from the hospital, so that we can make sure that they're doing okay. And so remote monitoring has been a key component there. One such example of how we've used home monitoring in UPMC International is at Upmec. We've done home monitoring for transplanted patients. And we have a number of clinical protocols where we have recurrent clinical monitoring post-discharge. The first 3 months are until the stabilization of clinical conditions. We have verification of therapeutic compliance. So this is really important for, of course, their immunosuppression and other medications that are necessary to them having great outcomes post-transplant. And also for verification of compliance with biohumoral and instrumental post-transplant surveillance schemes. We have the main functions of the device that we've utilized. It has video conferencing between the patient and the physician so they can have direct communication, as you can see. Periodic measuring of the vital parameters. Visual display of the calendar with planned activities so they know what's going on. And visual display of audiovisual reminders to encourage patients to follow their health protocols. Thinking about the store and forward concept, this really applies to teleradiology, teledermatology, and telepathology. And we've had for many years opportunities for teleradiology where we've had sharing of images, but in particular talking about telepathology. We've had services for Upmec since 1999, so we're going on beyond 20 years at this point. And also we've had relationships with clients in China where we've had essentially second medical opinions on patient diagnoses, where UPMC pathologists through a secure web-based telepathology portal have been able to receive these stored images and actually provide these second medical opinions, which has been extremely important and valuable. And so as we look to future projects, certainly including all of these services so that we can not only have expertise on the ground, but also expertise from around the world is really very important. As we think about the future, a couple of opportunities that I would like to highlight. Of course, we could talk for several hours, but in trying to condense down, thinking about virtual health for COVID-19 here in Italy. The scope of projects that we're working on is to implement and validate a telemedicine system for remote monitoring of patients' vital signs in various facilities or at home through an integrated hardware and software infrastructure provided with EMR technology tools for caregivers to support data collection, analysis, and recovery. So, of course, as we mentioned, is really monitoring for COVID-19 and also trying to keep an eye on patients who might not be able to get to hospitals or because of lack of capacity. And so a couple of different areas that we would look at are teleconsults for nursing homes, telemonitoring for asymptomatic patients and surveillance at home, for patients with who are symptomatic, and patients even with chronic diseases. Also, of course, can provide for tele-ICU opportunities, and again, monitoring of inpatients for COVID-19, but if the physician cannot be at the same location or there's any issues going on, providing this virtual health platform will be, again, another opportunity for us to provide very high quality care to the patient. One other opportunity I wanted to bring up was tele-oncology. This is a concept that we have being developed here in Pittsburgh with the Veterans Affairs Hospital. Pittsburgh has really been, and UPMC have been at the forefront of this, which is to actually develop this virtual cancer care clinic where we would have oncologists at a sort of hub location. And then we would have multiple spokes where we would have locations where patients would be receiving chemotherapy and actually from a telemedicine perspective being monitored by the oncologist. So this is a great opportunity to provide very high level cancer care close to home with monitoring from an expert clinician. And as you can see, here is that model with the hub and then the home facilities for the patients, where they're at their local infusion site. There would be providers, could potentially be registered nurses, APPs, and an on-site pharmacy, and the hub site would have all the necessary services. And so as we think about how we could extrapolate this to our international locations, certainly being able to provide from a central location high quality oncology care to regions that are in more less densely populated locations so that patients can stay closer to home. This would be a great opportunity for us to be able to provide these necessary services. And certainly as we extrapolate to China, we think about the vast regions and trying to keep patients as close to home as possible from our central location. This would be a great opportunity for us and something to look for in the future. As we also think about other opportunities in the future, UPMC Enterprises is certainly at the forefront of innovation. This is our arm that's looking at developing new drugs and diagnostics, and we hope to continue to see investments with global partners that will yield great opportunities for us in the telemedicine space. Coravi, Abridge, and Infectious Disease Connect to try to link to our patients and also to try to provide high-level telemedicine care and, of course, infectious disease care from Pittsburgh to our international locations. Lastly, again, just to finish up on terms of future opportunities, we want to think about creating a hub and spoke clinic model with the spokes staffed using telemedicine. We want to expand referrals to our international locations with post-acute or long-term follow-up conducted with telemedicine. We want to think about opportunities to use robotics and advanced video technology for inpatient rounding in hospitals or nursing homes where physicians might not be able to get to or they don't have on staff. We want to think about evaluation and post-care monitoring combined with on-site intervention to expand advanced subspecialties globally, and explore second medical opinion options between China and the US, leveraging telemedicine capabilities. So I want to thank you for your time today. I know this has been sort of a whirlwind of the past, present, and future of telemedicine care, but I think we have great opportunities moving forward, and telemedicine and virtual health are certainly here to stay. And as we now come out of the pandemic, I think opportunities and lessons learned from what we have seen during the pandemic can really be applied to future opportunities. And I want to remind everyone of our mission, which is to serve our communities by providing outstanding patient care and to shape tomorrow's health system through clinical and technological innovation, research, and education. So clearly virtual health will be at the forefront of everything that we do moving forward. And I want to thank you for your time.